For volunteers, you must maintain a training log. It will be reviewed at survey, so just be aware of that and have your training logs ready. And always make sure, might sound silly, but always make sure that the training happens before the first time they do the thing, so that, you have all your ducks in a row. Hi everyone, this is Mariam Treystman from the Home Health Consultant, and today we're going to be talking about the Hospice Volunteer Program. But first, if you like our content, please like, share, and subscribe. So, what is the Hospice Volunteer Program and why is it important? First, let's start with how this all started. The Hospice Program itself is actually rooted in the concept of volunteerism. Initially, nurses and clergy people help the dying with their emotional needs and their clinical needs in their end stages. And over time, this actually roots back to the 1800s in France and even, older in Middle Ages and things like that. Over time, this kind of grew as a movement, and sometime in the 1960s to 1980s, it went through a process of formalization and became integrated in the Medicare program as a formal program. But before that, it was just a bunch of people out of the goodness of their heart taking care of people in their last stages of life, and also their family after that person passed away. They also kind of checked in on the family to make sure they were grieving okay, that they were okay and things like that. So initially, the hospice program started as a volunteer program. Because of this, CMS wants to keep the spirit of volunteerism in hospice, both for kind of the emotional and moral significance of it, but also as a cost-saving method. And because of this, they require volunteers in hospice. So these volunteers, once they are onboarded, can do a few things. They can do direct patient care stuff. So what does that mean? We're probably not talking about wound care, clinical things. We're talking about companionship or maybe running an errand for a patient that's, within the scope of practice of, maybe picking up medication from the pharmacy or a grocery or, reading to them or delivering something from the hospice agency to the patient, whatever it is, or helping the family in some way to give them some respite or something like that. They can also do administrative and indirect support. This can include making admission packages, printing forms, delivering things to clinicians or back from clinicians, and just various things like that. Maybe community outreach efforts for the sake of bringing in referrals and things like that. They could also do some kind of bereavement activities that are not chaplain associated. Maybe they can write the bereavement cards to the family after the patient passes away and things like that. There are other roles that they can play, specialized volunteer roles. This is if you have volunteers that can do, some kind of skill thing. So some examples include pet therapy, music therapy, veteran to veteran programs and things like that. For the most part, the volunteers are performing activities around your hospice service, but not the direct activities of the hospice. So typically you're not going to get a volunteer for something that you would pay a clinician to do. If you have somebody on your payroll and then they also are volunteering, that's not really kind of the intention and the scope of the program. So if you are bringing on volunteers, it's preferred and usually going to be someone that's just in that volunteer capacity. For example, if you have your main nurse that does all your admissions and things like that, also volunteer nurse out doing volunteer admissions, that's not what we're talking about. We're talking about somebody just coming in and reading to the patient and things like that. So here's some required elements of the volunteer program. First of all, any volunteers that have anything to do with patients, patient care, or patient charting, really anything that's kind of has a responsibility to it, need to have a background check. many kind of clinical roles and so on. If you're having somebody interact with patients or with sensitive information, you really want to make sure that they're the right person and that, you're not leaving your agency vulnerable to like HIPAA violations or, various things like that. And so you want to do a background check just to make sure that they don't have like, sex crimes, felonies, like things like that. Just like everybody else, right? Like any of your clinicians, anyone who's touching patients, you should do like OIG and, things like that. While the law doesn't require the volunteers have to be at least 18 years old, it is still like a best practice because an adult will just have like more understanding of the sensitivities of the situation. So if you're going to have somebody who's like interacting with patients, you probably want them to be an adult at least. And there might be, some kind of liability in terms of like a minor going to like a random home. So probably definitely keep them 18 plus if they're going to be interacting with patients. If they're just making admission packages in your office, like that probably doesn't matter. But if you are going to have any kind of patient interaction, it's best if they're adults. The hospice is also required to train the volunteers and document this training, including like the dates of the training, what exactly they've been trained on. This includes who trained them, how long the training took, what date it was on, and so on. You really want to maintain like training logs for volunteers. Unlike other office positions, right? If you hire an intake person, there's not this legal requirement of having some like intense training log. If a surveyor comes in, they're not going to ask for like the training log of your medical records person. But for volunteers, you must maintain a training log. It will be reviewed at survey. So just be aware of that and have your training logs ready. And always make sure, might sound silly, but always make sure that the training happens before the first time they do the thing, so that, you have all your ducks in a row. Further, you are required to have some kind of method of recruitment. This means you can kind of list how it is you're recruiting or where you're looking for volunteers, but surveyors will ask for how it is you're looking for volunteers. So one of the things that we do is we help people make volunteer flyers that then they can drop off at local churches and, things like that, just various places where you can find volunteers. And the most important part of the volunteer program is documenting the cost savings of the program. This is related to the COP of volunteer usage, which is that your volunteer utilization needs to be at least 5% of patient care hours. So let's talk about what that means. If you have 20 patient care hours in a week, that means you have to have 1 volunteer hour at least in that week. They're not going to look at it like week to week or day to day, but definitely on a monthly basis, you want to have some kind of documentation and logging of the time the volunteers are being used in relation to your patient care hours, what it is they're doing, and what you think the cost savings are. Like if you were to hire somebody for that position, how much would you pay them? And then you would multiply it by the number of hours the volunteer has worked to get your cost savings amount. All of this is reviewed at survey by surveyors as a COP. So you definitely want to have this in place. The other critical piece of this is you need to notify patients and caregivers if they will be interacting with volunteers in any way. So if the volunteer is dropping off a care kit, then whoever is receiving the care kit needs to know that this is a volunteer dropping it off. Whatever it is, if the volunteer is going to go perform companionship services, like go and read to the patient or just hang out with them, whatever, they need to know that it's a volunteer. And patients and caregivers do have the right to refuse volunteers, just like they have the right to refuse any of your services. And so notification that it is a volunteer is critical to have informed patient consent and involvement in their care, which is also actually a COP. In terms of management of the volunteers, there needs to be a representative for the volunteer program in the IDG meetings, which happens no less frequently than every 15 days. In these meetings, we are reviewing the volunteers' involvement in the care plan and seeing if there needs to be any kind of adjustment to their involvement. And so the representative of the volunteer program is the volunteer coordinator. You could also have a volunteer or the volunteer at the IDG meetings, but typically people will just have the volunteer coordinator participate. And the volunteer coordinator, unless you're a larger agency, can be somebody who's already in the IDG meeting, but they just have like this additional role. And a lot of times agencies will have the bereavement coordinator be also the volunteer coordinator, because those activities can fall hand in hand. Like the way I've seen people use volunteers a lot is writing the cards for the bereavement and just like kind of interaction with like caregivers and family and things like that. If you are non-compliant to the volunteer program, this is a problem because this is a conditional requirement. It is integral to the hospice concept for CMS. And so they are very strict on making sure that the volunteer program is carried out properly. And so there are a couple of questions remaining, like where can you find hospice volunteers? A hospice volunteer, that's like a special person who, because sometimes you might think like who would go volunteer for this role. So first, one of the main places actually that you can find hospice volunteers is family members of people who have passed away through your hospice programs. Sometimes those family members feel like they want to give back and help people who are also struggling with something that they've also been through. And so though here and there, you'll have somebody like a family member from like from a previous patient volunteer in your hospice. That's not to say that you should go solicit them, but we have seen cases where family will volunteer to volunteer. Other ways to find volunteers, like I said before, you can take your flyer and take it around churches and temples, other kind of religious establishments. Typically, people who want to volunteer in this capacity are looking for this kind of like giving back mechanism. Will find this like really useful and helpful. Other ways, you can look around in clinical settings for students. Like, for example, if you're trying to become a doctor, one of the things that medical schools look for in acceptance is what kind of internships or related volunteer programs you've been involved with. So a lot of like aspiring clinicians will need to have these kinds of hours for both their clinical programs or just like to qualify for furthering their education and things like that. And in that same spirit, just reaching out to like universities, colleges, and if you're going the not 18 plus route, you can also reach out to like high schools to see if there's volunteer opportunities there. Pretty much, unless it's somebody who's like really trying to volunteer in this capacity, you're looking for somebody who needs like credits or, you know, some resume item, things like that. Like if we're just being blunt, this is why people volunteer for this. It's either they've had this experience and they want to help others through this kind of difficult time, or they need it for something. Like they need it for their job, they need it for their school, they need it for qualification to something and things like that. You can also try to look in formalized organizations that are hospice related, because they might be doing this kind of sourcing already. So like hospice foundations, any kind of veterans organizations, and just like things like that. If you Google around, you might find local things. If you're going with an organization like this, you want to look for local because you need them to like come to your office, do things like that. So lastly, of course, you're going to need to, as we've mentioned before, train them. And also, because this is, I think it's like a little bit harder to find, right? Like most people or many people don't want to interact with death on this level. So retention strategies are important here too, because once you find them, you want to keep them. Of course, with training, there are some important elements to training outside of the tasks that they would be doing. So like, of course, if they're making admission packages, discharge packages, yeah, you're training them on those activities. But besides that, there's some other concepts that you need to train them on. So first and foremost, you want to take them through your general agency orientation, mission, values, goals, like all that orientation stuff that you have to do with everybody that comes through your doors. Adult abuse reporting requirements, like whatever, all that stuff that's included in there. They need to understand the concept of a hospice and associated regulations that could lead to a non-compliance element. So like, that's kind of be careful with volunteers, because when you hire people to work in your company, first of all, they're probably like just there more, right? Like the volunteer might come once a week or, whatever. And so somebody who's just like in your office every day will be more aware of the rules of the industry and like best practices and things like that. So you want to make sure that that they really understand what hospice is all about, and like important rules like HIPAA and confidentiality, patient privacy rights, and things like that. Like, you don't want to photograph patients and things like just post on social media. I don't know, whatever it is, right? Also, whatever your office might have in terms of phone etiquette and communication with patients and families, they need to understand that people are going through a hard time and to maybe be a little patient with them and just things like that. So besides the actual tasks that they're performing, they need to be aware of these additional elements. And lastly, retention strategies are going to be retention strategies like they are across the board with any employee, but like times 10. You want to be very, very kind of verbal in your praise and positive feedback and things like that, because this is kind of like a negative vibe. I don't want to say the industry is, of course, it's such a useful and important service. Like for the patients and families that are receiving the service, sometimes it's just like changes the experience from something that's horrible for them to, of course, still not great, but better. But you are just face to face with death all day long. So you want to try to keep positive elements in their face as much as possible, pretty much. You also want to have concepts for emotional support. Like sometimes people feel like they'll be okay in an environment and then they get into an environment and can trigger some like emotions and just like different things like that. So you want to have those elements ready, which you probably do anyways if you're a hospice, like some kind of like debriefing or, whatever, things like that. Help them process the emotions of being face to face with death like that if they're going to be like patient facing and stuff like that. And of course, like any kind of, back to the positive feedback, any kind of recognition, certificates, like, one really cool way to go about this is when you bring volunteers, you can make a volunteer program, as in like, here's our 20-hour program. So the completion of the program requires 20 hours. And here's what we do in those 20 hours. So you like create like a framed structure around not just like, come whenever you have time, or like instinctively you might think that you want to be accommodating to like schedules and this and that. But sometimes the more you formalize procedures and processes around something, you're just going to get more buy-in from people because they're working within a program. They know they have to hit like 20 hours or 40, whatever your situation is. And so that kind of formalized structure is just going to make sure that they get to 20 or they get to 40 versus like doing 7 and being like, nah, I'm out. This is not for me. And so having like this kind of like structure, and then having a certificate at the end of it, or having something like that at the end of it, really helps. And so that's pretty much the general ideas around the volunteer program. It started out of, the goodness of people's hearts, just helping people who are in this part of their life, and ultimately became a Medicare funded program, which is really cool. It's cool that our, country and our government values people at the end of their life, cares that people die comfortably, and cares about family and caregivers even after the patient's death. So do your best, find your volunteers. There are amazing people who are willing to do this stuff, who are willing to do this work, and they really do deserve whatever recognition you can give them. And hopefully everything goes well for you. So thank you so much for listening. This is about the Hospice Volunteer Program. And if you like our content, please like, share, and subscribe. I'm Mariam Treystman from the Home Health Consultant.